Thanks so much. And for more on this health care bill and the process ahead, it's a long process still to come. We're joined now by Democratic Congressman Eiljah Cummings, senior member of the House Oversight and Government Reform Committee and one of the top leaders on the Hill. Congressman, the House obviously supports a very different approach to health care. You've seen what's come out of Senate Finance. If this bill is along the lines of what Olympia Snowe couldn't support, how does the House then, in conference, come up with something that you guys can vote for?
I am hoping that that they will come out with a little stronger bill than what they came up with out of committee yesterday. That is the Senate. That's going to be very difficult, Andrea, because I think Savannah is absolutely right. The House is going to come up with a very strong and robust public option in the bill. And as I listened to the comments that you were making with regard to the statement of Susan Collins, I think the public option would almost resolve every issue that she stated there. And so it's going to be very, very difficult. But we will wait and see what they come up with. I applaud Ms. Snowe for what she's done. I think she did not close the door, while her other Republican colleagues pretty much did in a way. And now we have to wait for a bill to come out and see what Harry Reid does. We still have to see how he's going to meld these these bills from these two committees from the Senate together. So I think I don't expect him, by the way, to have a public option in the bill, but I do expect that he will listen to Ms. Snowe and a lot of the things that she's concerned about, like affordability and things of that nature. I think perhaps they'll come up with some strong provisions, and then hopefully when we get to conference and look at the House and Senate bill, we'll be able to come up with something that all of us can live with.
Well, she said, Olympia Snowe said this morning on all of her interviews, Today Show, Morning Joe, she said that a public option would be problematic for her. Yet at the same time, she has suggested in the past, she suggested last winter, a public option that would be triggered if the marketplace is not working. Would that be acceptable to those of you on the House side who support a public option? I
think it would be very difficult, because I think what we would worry about is that the trigger would never be pulled. And I guess we would have to look at that. But I can tell you the Progressive Caucus and I'd say the majority of the Democrats in the House are really, really anxious to see a strong public option. And so the President said in his speech to Congress, the joint session, that if there were some alternatives that could achieve the goal of affordability and quality, that he would take a look at them. So I'm assuming that when he sits down with the folks from the Senate today, he'll be looking at what they are trying to do, and it'll be interesting to see what comes out of that. But I think the President has a very strong hand in this right now, and I think he needs to use it to the nth degree.
Well, is the Progressive Caucus going to be disappointed? It would seem that the President is now really going for the center in both foreign policy and in the health care arguments. All the signals coming from the White House, they had another meeting this morning, is that he's probably going to take some sort of a middle road. That's certainly what his defense and Secretary of State, cabinet ministers want him to do. What are you going to do in the Liberal or Progressive Caucus if you find your president going against you on both health care and Afghanistan?
Andrea, that is probably one of the most troubling questions that confront us. The fact is that we know that this is a priority for the president, but more importantly, it's a priority. This health issue is a priority for our constituents, and so I think we're going to have to wait and see. I'm hoping that the president, when he meets, will stick to his speech before the joint session of Congress, where he pushes very, very hard to get a public option, and then we're just going to have to wait and see. We'll cross that bridge when we get to it, but right now we want a strong Senate bill to come out so that we will not have so much distance to go when we go into conference.
Now, let me ask you about Charlie Rangel, the chairman of the Ways and Means Committee, an esteemed veteran member who is now under ethics investigation. Our own Betsy Klein caught up with him at the Ronald Reagan building yesterday, and this is what ensued when she tried to ask a reasonable question about his ethics problems. Let's watch.
Do you foresee the ethics panel investigation hindering your work as chairman of House Ways and Means?
If I did, I would not continue to be the chair.
How exactly did you forget to file that on your taxes?
You shouldn't be that way. You know that. You really, I know it's your job, and I don't blame you, but it's really so rude.
And I have to tell you that was the tail end. We'll show a little bit more of that later on in the program. But Betsy Klein followed him from inside the building. He was surrounded by reporters. She persistently and politely asked him questions. How is his effectiveness being hurt by the fact that Charlie Rangel, who's always so accessible to reporters and one of the best liked persons on the Hill, how has his effectiveness as chairman been damaged by this experience?
To be very frank with you, if I look at it from the standpoint of how has Charlie Rangel been functioning and accomplishing his job, I think he's doing a very good job. Now, how others may view it is a whole other thing. But again, Andrea, keep in mind what the House has already said as a result of a vote last week, that we are referring this to the ethics panel. They'll look at it, and they'll look at it very strictly. As a matter of fact, they've already decided to widen their investigation, and so they'll deal with it. And I think that Charlie Rangel obviously feels comfortable that he can continue to do his job. I think as a matter of fact, I know he can and do it well. So I think we need to wait and see what the ethics panel comes up with, if anything, and then go from there.
Well, should he step aside?
No. If he's up here, first of all, Charlie Rangel will make it clear that if he felt that he was bringing harm to the House or if he couldn't do his job, I think he would be the first one to say that. And I sat beside him the other day while they were reading the charges, and it's clear to me that he feels very comfortable that he can continue to do the job.
But should he be the judge of that, or should his peers be the judge of that?
I think to a degree, his peers have already been a judge. What they've said was, through a majority vote, is that it would be referred to a group of his peers, which is the ethics panel. They will make a determination, Andrea, and then we'll go by that.
All right, Eiljah Cummings, thank you very much for joining us today.
Thank you. It's always a pleasure.
Good to see you.
Good seeing you.
Pleasure is ours. And